My doctor said my symptoms weren't serious. Then I collapsed in his examination room. I woke up on Dr. Richard Kelsey's examination room floor with 4 paramedics surrounding me, an oxygen mask on my face, and the taste of copper in my mouth. The fluorescent lights burned my eyes. My chest felt like someone had driven a railroad spike through my sternum. I could hear Dr. Kelsey talking to the paramedics, his voice tight with what I'd later recognize as fear, disguised as clinical detachment. Patient is 38 years old, history of anxiety, came in complaining of chest tightness and fatigue, became unresponsive approximately 90 seconds ago. I tried to tell him it had been longer than 90 seconds, that I'd felt myself going down, that I'd grabbed for his desk and missed, that I'd been conscious long enough on that floor to see his expression shift from irritation to panic. But the oxygen mask muffled my words, and one of the paramedics was already sliding a needle into my arm, starting an IV, while another attached EKG leads to my chest. The machine started beeping, a rapid staccato that made the lead paramedic's eyes go wide. "We need to move now. He's in VTACH. Get the stretcher." They lifted me onto the gurney, and I caught a glimpse of Dr. Kelsey standing against the wall of his examination room, his face pale, his expensive Italian loafers splattered with my vomit from when I'd gone down. He wouldn't meet my eyes. I'd been seeing Dr. Richard Kelsey for 18 months, ever since my previous physician retired, and I needed someone to manage my annual physicals and the occasional sinus infection. Kelsey had great reviews online, a fancy office in a medical plaza near downtown Seattle, and a calm, authoritative manner that made you feel like you were in capable hands. He was in his late 50s, silver hair perfectly styled, always wearing expensive suits under his white coat. His office walls displayed his credentials prominently: medical degree from Johns Hopkins, residency at Massachusetts General Hospital, board certified in internal medicine, 26 years of practice. He had that polished confidence that made you trust him immediately. That was the problem. I'd trusted him completely, even when my body was screaming that something was wrong. Even when every instinct told me I was dying, I'd let his calm dismissals override my own experience, because he was the expert, and I was just an anxious patient who spent too much time Googling symptoms. The chest pain had started 3 months earlier, in late October. I was at my desk at the accounting firm where I worked as a senior analyst, reviewing spreadsheets for a client audit, when I felt a sudden pressure in the center of my chest. Not sharp pain, just a deep, squeezing sensation like someone had wrapped a belt around my rib cage and was slowly tightening it. My left arm started to tingle. I stood up, thinking I'd been hunched over my keyboard too long, needed to stretch, but the pressure didn't ease. It got worse. I felt short of breath, dizzy, like the office was tilting. My coworker Stephanie noticed me gripping the edge of my desk. "You okay, David? You look really pale." I told her I was fine, probably just heartburn from the coffee and breakfast burrito I'd grabbed that morning. The pressure lasted 20 minutes before gradually fading. I sat back down and tried to focus on work, but my hands were shaking. I'd just turned 38 2 weeks earlier. I was in decent shape, ran 3 miles 4 times a week, ate relatively healthy, didn't smoke, drank maybe 3 beers a week. Heart attacks happened to other people, older people who didn't take care of themselves, not to me. The episodes kept happening, 3 more times that first week, always triggered by exertion or stress. Climbing the stairs to my apartment on the 3rd floor, arguing with my ex-wife about custody arrangements for our daughter Lily, rushing to meet a deadline at work. Each time, the same crushing pressure in my chest, the same tingling in my left arm, the same breathlessness and dizziness. Each time, I told myself it was stress, anxiety, muscle strain, anything except what it obviously was. By the end of the 2nd week, I was getting the episodes daily. I started avoiding stairs, taking elevators everywhere, parking as close to building entrances as possible. I stopped running because the exertion triggered the chest pressure within minutes. My appetite disappeared. I felt exhausted all the time, like I was walking through water. Sleep was impossible because lying flat made my breathing worse, so I spent nights propped up on my couch with pillows, dozing fitfully while late-night infomercials played on mute. I finally called Dr. Kelsey's office and got an appointment for the following Thursday. His receptionist asked what I was coming in for, and I said chest pain. She paused, asked how severe, asked if I needed to go to the emergency room instead. I told her it came and went, wasn't constant, and I'd already waited 2 weeks, so another few days wouldn't matter. She booked me for 2:30 p.m. I counted down the hours, convinced that once Dr. Kelsey examined me, he'd order tests and find the problem and fix it. I'd been irrational to worry so much. Doctors existed to solve exactly these kinds of problems. If you are enjoying this story already, please subscribe to see more stories like this. Dr. Kelsey spent maybe 6 minutes with me during that first appointment. I described the chest pressure, the arm tingling, the shortness of breath, the episodes triggered by exertion. I told him I was worried about my heart. He listened while typing notes into his computer, barely looking at me. When I finished, he swiveled his chair to face me and smiled. "David, you're describing classic anxiety symptoms. The chest tightness, the arm tingling, the breathing difficulty. These are all manifestations of panic attacks. You're under a lot of stress, correct? Divorce, custody issues, demanding job?" I nodded, and he continued. "Your body is responding to psychological stress with physical symptoms. It's extremely common, especially in men your age dealing with major life changes. He checked my blood pressure, which was slightly elevated at 142/88, and listened to my heart for maybe 15 seconds with his stethoscope. Heart sounds normal. Lungs are clear. Your EKG from your physical 6 months ago was completely normal. You're 38 years old. You exercise regularly. You have no family history of cardiac disease. The likelihood of this being a cardiac issue is extremely low. What you need is stress management, maybe some therapy to work through the divorce anxiety, and I'm going to prescribe you a low dose of Xanax to take when you feel the panic attacks coming on. I tried to push back, but the pain is really intense, and it only happens when I exert myself, when I climb stairs or move around. That seems different from anxiety. Dr. Kelsey's expression shifted slightly, a flicker of impatience crossing his polished features. David, anxiety doesn't follow logical patterns. It can be triggered by physical exertion because your body associates exertion with stress response. The symptoms you're describing are textbook panic disorder. I've been practicing medicine for 26 years. I've seen thousands of patients with anxiety, and I can assure you, this is not cardiac. Taking anxiety medication and implementing stress reduction techniques will resolve your symptoms completely. Trust me. I wanted to trust him. He was the expert with the medical degree and the decades of experience and the prestigious credentials on his wall. I was just a guy who worked with numbers and was probably catastrophizing because I'd spent too much time reading WebMD. I took the prescription for Xanax and left his office feeling both relieved and unsettled. The Xanax didn't help. The chest pressure continued, getting worse and more frequent. By early December, I was having episodes 5 or 6 times a day. My boss pulled me aside and asked if everything was okay, because my work quality had dropped noticeably. I was making errors in spreadsheets, missing details, losing focus during meetings. I told him I was dealing with some health issues, but was working on getting them resolved. My ex-wife Allison called to say Lily had asked why Daddy seemed so tired all the time during our weekends together. I'm worried about you, David. You don't look good. You've lost weight. Are you eating? I wasn't eating much. Food tasted like cardboard, and my stomach was constantly unsettled. I'd lost 15 pounds in 6 weeks without trying. My clothes hung loose on my frame. When I looked in the mirror, I barely recognized the pale, exhausted man staring back. I called Dr. Kelsey's office again, got another appointment, this time on a Friday afternoon in mid-December. I brought documentation, a detailed log I'd been keeping of every chest pain episode, including the date, time, duration, severity, on a scale of 1 to 10, and what triggered it. 3 weeks of data showing a clear pattern of exertional chest pain that was getting progressively worse. Dr. Kelsey glanced at my log for maybe 30 seconds before setting it aside. David, I appreciate that you're tracking your symptoms, but this kind of obsessive monitoring actually worsens anxiety. You're hypervigilant, constantly scanning your body for problems, which creates a feedback loop where you generate the very symptoms you're worried about. You're catastrophizing, convincing yourself that normal physical sensations are evidence of serious disease. The Xanax should be helping with this. Are you taking it as prescribed? I told him I was taking it, but it wasn't working. The chest pain was getting worse, not better. I was exhausted all the time. I couldn't sleep lying down. I'd lost 15 pounds. Something was genuinely wrong with me. He checked my blood pressure again, which had climbed to 155/92, and listened to my heart for another brief moment. Your blood pressure is elevated because you're anxious right now, sitting in a doctor's office worried that you're dying. Your heart rhythm is regular. Your lungs are clear. David, I understand you're scared, but I need you to hear me clearly. This is anxiety. You are not having a heart attack. You are not going to die. What you're experiencing is your mind creating physical symptoms through the stress response. I'm going to increase your Xanax dosage, and I want you to start seeing a therapist who specializes in health anxiety. Cognitive behavioral therapy is very effective for patients who fixate on physical symptoms. I also want you to stop Googling your symptoms and stop obsessively tracking every sensation in your body. You're making this worse by feeding your anxiety. I left that appointment feeling gaslit, dismissed. My body was telling me something was desperately wrong, and the person I'd trusted to help me was telling me it was all in my head. I tried to believe him. I wanted to believe him. But the chest pressure continued, the episodes got longer and more severe, and a new symptom appeared. Profound fatigue that made even simple tasks exhausting. Going to the grocery store required planning and rest breaks. Taking a shower left me breathless and shaky. Playing with Lily during my custody weekends meant sitting on the couch while she showed me her drawings, because I didn't have the energy to get on the floor with her toys. Christmas came and went in a blur of chest pain and anxiety medication that didn't work. I spent the holiday with Lily at my parents' house in Tacoma, struggling to hide how terrible I felt. My mother pulled me aside on Christmas afternoon, her face tight with worry. David, you look awful. What's going on? Have you seen a doctor? I told her I had, multiple times, and he said it was just anxiety from the divorce. She looked skeptical. This doesn't look like anxiety. This looks like you're sick. You need to get a second opinion. I promised I would, but I didn't. Doctor. Kelsey had made me feel foolish for being worried, had framed my concerns as irrational catastrophizing, and I couldn't face going through that with another doctor who might say the same thing. The problem was me, my anxious brain, my inability to accept that I was fine. By early January, I could barely function. I'd used up all my sick days at work and was dipping into vacation time. I couldn't climb a flight of stairs without stopping halfway to catch my breath. My heart raced constantly, a rapid fluttering sensation that never quite settled into a normal rhythm. I started having episodes where my heart would suddenly accelerate to what felt like 200 beats per minute, pounding so hard I could see my shirt moving with each beat. These episodes lasted 5 to 10 minutes before gradually slowing down. I told myself it was panic attacks, just like Dr. Kelsey said, but panic attacks didn't usually wake you up at 3 a.m., with your heart trying to hammer out of your chest. On January 8th, a Wednesday, I had an episode at work that was worse than any previous one. I was in a meeting with my team reviewing year-end reports when the chest pressure started. Within seconds, it was crushing, like someone had parked a car on my sternum. My left arm went completely numb. I couldn't catch my breath. Cold sweat poured down my face. The room started to fade out, edges going dark. My boss called 911. The ambulance arrived and paramedics ran an EKG in the conference room while my coworkers watched through the glass walls. One of the paramedics frowned at the EKG printout and showed it to his partner. They had a quick, quiet conversation I couldn't hear. Then the first paramedic turned to me. "Sir, your EKG is showing some abnormalities. We're going to transport you to Harborview Medical Center to get you checked out. Do you have a history of heart problems?" I told him about the 3 months of symptoms, about seeing Dr. Kelsey, about being diagnosed with anxiety. The paramedic's expression shifted to something between concern and frustration. "Okay, well, let's get you evaluated properly at the hospital." They loaded me into the ambulance, and during the ride, the crushing chest pressure gradually eased. By the time we reached Harborview's emergency department, I felt almost normal again, just exhausted and shaky. The ER doctor was a woman in her 40s named Dr. Patricia Nguyen. She reviewed my EKG from the ambulance and immediately ordered more tests. Blood work to check for cardiac enzymes that would indicate heart damage, another EKG, a chest x-ray. She asked detailed questions about my symptoms, my timeline, my family history. "Have you had any cardiac workup done? Any stress tests, echocardiogram, advanced imaging?" I told her no, just the basic EKG from my annual physical last summer. That was normal. Dr. Nguyen made notes, her expression thoughtful. The EKG from the ambulance shows some concerning changes. T-wave inversions and ST segment abnormalities that could indicate cardiac ischemia, meaning inadequate blood flow to your heart muscle. Your symptoms are very concerning for unstable angina or even a cardiac event. We're going to keep you here for observation and run additional tests. The blood work came back showing elevated troponin levels. Dr. Nguyen explained this meant my heart muscle was being damaged, likely from inadequate blood flow. She admitted me to the cardiac unit and scheduled a cardiac catheterization for the next morning. During that procedure, they'd thread a catheter through an artery in my groin up to my heart and inject dye to visualize my coronary arteries, looking for blockages. I spent that night in a hospital bed with monitors beeping around me, trying to process the fact that I'd been right all along. Something was wrong with my heart. Dr. Kelsey had been wrong, dangerously wrong. The cardiac catheterization showed severe blockages in 2 of my major coronary arteries. The cardiologist performing the procedure, Dr. Alan Foster, a specialist with 32 years of experience in interventional cardiology, showed me the imaging afterward. "See these areas here? These are significant stenoses, narrowing of your arteries by 80 to 85%. You have critical coronary artery disease. The chest pain you've been experiencing is unstable angina, which is a warning sign that you're at extremely high risk for a major heart attack. We're going to place stents in both arteries today to open them up and restore proper blood flow. If we hadn't caught this, you likely would have had a massive heart attack within the next few weeks, possibly fatal. You're very lucky your colleagues called 911 when they did." Lucky. I didn't feel lucky. I felt angry and betrayed and terrified. I'd been telling Dr. Kelsey for 3 months that something was wrong. I'd documented symptoms. I'd begged for tests. And he'd dismissed everything as anxiety, had made me question my own sanity, had let me walk around with critical coronary blockages that could have killed me at any moment. Dr. Foster placed 2 stents during the procedure, opening up the blocked arteries. The relief was immediate. For the first time in months, I could breathe normally. The crushing chest pressure was gone. I felt like I'd been living underwater and had finally surfaced. I spent 3 days in the cardiac unit recovering from the procedure. During that time, Dr. Nguyen from the ER came to check on me. She sat down in the chair next to my bed, her expression serious. "David, I've been reviewing your case and I'm deeply concerned about the delay in your diagnosis. You presented to your primary care physician with classic cardiac symptoms 3 months ago, and those symptoms were dismissed as anxiety. That's a significant failure of care. I've seen this pattern before, unfortunately, where patients, particularly younger patients, or patients experiencing stress, have their cardiac symptoms attributed to psychological causes without adequate workup. I want you to know that you should file a complaint with the state medical board about Dr. Kelsey's treatment. What happened to you represents medical negligence. I'd been thinking the same thing, lying in that hospital bed with IV lines in my arms and stents in my arteries. Dr. Kelsey had nearly killed me through his dismissiveness and arrogance, but Dr. Nguyen's validation, her professional assessment that this was negligence, gave me the confirmation I needed to act. When I was discharged from the hospital with a stack of new medications and instructions for cardiac rehabilitation, I contacted a medical malpractice attorney named Thomas Brennan. His office was downtown, modern and professional, with framed case settlements lining the walls. Brennan was in his early 50s, graying at the temples, with the sharp, focused demeanor of someone who'd spent decades fighting institutions. He listened to my entire story, taking detailed notes, asking clarifying questions about dates and specific conversations with Dr. Kelsey. When I finished, Brennan leaned back in his chair. "This is a clear case of medical negligence, David. Dr. Kelsey failed to meet the standard of care in multiple ways. First, he dismissed classic cardiac symptoms without performing appropriate diagnostic workup. Chest pain with exertion in a male patient, even a younger one, should trigger an immediate cardiac evaluation, including stress testing at minimum. Second, when you returned with worsening symptoms and documented progression, he failed to reassess his initial diagnosis or order any additional testing. Third, he attributed your symptoms to anxiety, despite those symptoms not responding to anxiety treatment, which should have prompted reconsideration of the diagnosis. Fourth, your weight loss, fatigue, and inability to exert yourself were all red flags he ignored. This isn't a borderline case. This is egregious negligence that could have resulted in your death. If this story keeps your interest, please subscribe to get more stories like this." Brennan filed a formal complaint with the Washington State Medical Commission, the body responsible for investigating physician misconduct and enforcing medical practice standards. He also began building a medical malpractice lawsuit, starting with obtaining all my medical records from Dr. Kelsey's office and from Harborview. The records from Kelsey were damning. His notes from our appointments were brief and dismissive, full of phrases like patient exhibiting health anxiety, symptoms consistent with panic disorder, patient resistant to psychological explanation for symptoms. He documented my elevated blood pressure but attributed it to white coat syndrome, the anxiety of being in a doctor's office. He'd never ordered a single diagnostic test beyond the basic EKG from my annual physical. He'd increased my Xanax dosage instead of investigating my worsening symptoms. His notes painted a picture of a patient who was irrationally anxious rather than a patient who was accurately reporting cardiac symptoms. The records from Harborview told a different story. Dr. Nguyen's detailed documentation of my presentation, the abnormal EKG from the ambulance, the elevated troponin levels indicating cardiac damage, the catheterization results showing critical blockages. Dr. Foster's procedure notes describing arteries that were 80 to 85% occluded, blockages that had been developing for months or possibly years. Multiple cardiologists had reviewed my case, and all agreed that my symptoms had been obviously cardiac in nature, and that the delay in diagnosis represented a serious failure of care. Brennan hired a medical expert to review the case, Dr. Lawrence Mitchell, a former chief of cardiology at a major teaching hospital, who now worked as an expert witness in medical malpractice cases. Dr. Mitchell's report was scathing. He concluded that Dr. Kelsey's failure to order cardiac workup when I first presented with exertional chest pain was a gross deviation from accepted standards of medical care. He noted that any competent internist would have recognized these symptoms as concerning for cardiac disease and would have ordered appropriate testing, including stress test, echocardiogram, and potentially cardiac catheterization. He stated that the delay in diagnosis placed the patient at severe risk of fatal myocardial infarction, and the outcome could easily have been death. His conclusion: Dr. Kelsey's negligence was clear and indefensible. While the malpractice case was being prepared, the medical commission investigation moved forward. As part of that investigation, I learned something that made my blood run cold. I wasn't the first patient Dr. Kelsey had dismissed. The investigator assigned to my case, a woman named Diana Flores, who'd worked for the medical commission for 15 years, called me 6 weeks after the complaint was filed. "Mr. Whitmore, I wanted to let you know that your complaint has prompted us to open a broader investigation into Dr. Kelsey's practice patterns. We've identified 3 other patients who filed complaints in the past 4 years regarding diagnostic delays and dismissal of serious symptoms. In 2 of those cases, the patients suffered significant harm as a result. I'm not at liberty to share details, but I wanted you to know that your case is part of a larger pattern. 3 other patients, 3 other people who'd been dismissed and harmed." I asked Diana if any of them had died. She paused before answering. One patient suffered a fatal stroke after Dr. Kelsey dismissed her headache and vision changes as stress-related migraines. She was 42 years old. She had 3 children. The family settled a wrongful death suit against Dr. Kelsey 2 years ago, but the settlement included a non-disclosure agreement, so the case wasn't public. The medical commission reviewed the case at the time, but didn't take action because it was presented as an isolated incident. Your complaint has given us cause to look deeper. I felt sick. A woman had died because Dr. Kelsey dismissed her symptoms. Her children had lost their mother, and the system had let him continue practicing, continue dismissing patients, continue causing harm. Diana continued. The other 2 cases involved delayed cancer diagnoses. One patient presented with persistent abdominal pain and bloating that Dr. Kelsey attributed to irritable bowel syndrome without ordering imaging. By the time she was finally diagnosed with ovarian cancer by another physician, it had reached stage 4. She's currently in hospice. The second patient had a delayed diagnosis of colon cancer after Dr. Kelsey dismissed rectal bleeding as hemorrhoids. That patient survived but required extensive surgery and chemotherapy that might have been avoided with earlier detection. Both patients filed complaints, but the medical commission closed those cases after Dr. Kelsey provided explanations for his clinical decisions. Your case, combined with these other cases, demonstrates a pattern that we can no longer ignore. The medical commission's investigation expanded. They reviewed hundreds of Dr. Kelsey's patient charts looking for patterns of diagnostic delay and failure to order appropriate testing. What they found was systematic. Dr. Kelsey had a pattern of dismissing symptoms, particularly in certain demographics. Women with cardiac symptoms were routinely diagnosed with anxiety. Younger patients with serious symptoms were told they were too young to have serious disease. Patients who expressed worry about their symptoms were labeled as hypochondriacs or health anxious, and their concerns were documented in ways that undermined their credibility. The investigation revealed that Dr. Kelsey saw an average of 35 to 40 patients per day, spending an average of 7 minutes per patient. He ordered fewer diagnostic tests than any other internist in his medical group. His pattern was to make quick assessments based on demographics and superficial presentations, then dismiss patients whose symptoms didn't fit his initial snap judgment. The medical commission scheduled a formal hearing. I was called to testify, along with family members of the woman who died from the stroke and the 2 cancer patients. The hearing room was sterile and intimidating, with a long table where the commission members sat, 5 physicians and 2 public members who would judge whether Dr. Kelsey's conduct violated medical practice standards. Dr. Kelsey attended with his attorney, an expensive defense lawyer who specialized in representing physicians. Kelsey looked smaller than I remembered, less polished. His silver hair seemed grayer. His expensive suit couldn't hide the fact that he knew his career was imploding. I testified for 90 minutes, walking through my 3 months of symptoms, my multiple appointments with Dr. Kelsey, his repeated dismissals, his refusal to order testing, his insistence that everything was anxiety. I presented my symptom logs, my medical records, Dr. Foster's catheterization findings, Dr. Mitchell's expert opinion. The commission members asked detailed questions about my interactions with Dr. Kelsey, about what specific language he'd used when dismissing my concerns, about whether he'd ever explained why he wasn't ordering cardiac testing. I answered everything as accurately as I could, trying to keep my anger in check, trying to stay factual and credible. The daughter of the woman who died from the stroke testified next. Her name was Rebecca Thorne, and she was 24 years old. She described her mother, Lisa, a vibrant woman who'd been a middle school teacher, who'd gone to Dr. Kelsey complaining of severe headaches and vision disturbances. Dr. Kelsey had diagnosed stress-related migraines, prescribed pain medication, told her to reduce her workload and get more sleep. The headaches worsened over 3 weeks. Lisa returned to Dr. Kelsey twice more, describing the same symptoms with increasing severity. He increased her migraine medication and suggested she see a therapist for stress management. On the 4th week, Lisa collapsed at school while teaching. She'd had a massive hemorrhagic stroke caused by an undiagnosed cerebral aneurysm that had been leaking for weeks. The headaches and vision changes were classic warning signs that Dr. Kelsey had missed or dismissed. Lisa died in the hospital 3 days later without regaining consciousness. Rebecca's testimony was devastating. She cried while describing how her mother had trusted Dr. Kelsey completely, had believed him when he said it was just stress, had died thinking she'd been overreacting to normal headaches. The 2 cancer patients testified about their delayed diagnoses. The woman with ovarian cancer, Margaret Sutherland, was pale and thin, wearing a headscarf to cover her hair loss from chemotherapy. She was 49 and had presented to Dr. Kelsey with persistent bloating, abdominal pain, and feeling full quickly when eating. Classic ovarian cancer symptoms. Dr. Kelsey had diagnosed IBS without ordering any imaging, without doing a pelvic exam, without running CA-125 tumor marker tests. He'd prescribed dietary changes and anti-anxiety medication. Margaret had followed his advice for 6 months before the pain became unbearable and she went to the emergency room. CT scan showed advanced ovarian cancer that had metastasized to her liver and lymph nodes. Stage 4, terminal. She had maybe 6 months left to live. Her testimony was quiet and matter-of-fact, describing how Dr. Kelsey's dismissal had stolen her chance at survival, how she was now planning her funeral instead of watching her grandchildren grow up. The commission members' expressions grew increasingly grim as the testimony continued. Dr. Kelsey's attorney tried to argue that each case represented reasonable clinical judgment, that doctors can't order every test for every symptom, that hindsight bias was making normal clinical decisions appear negligent. But the pattern was undeniable. 4 patients, 4 serious conditions missed, 4 instances of symptoms dismissed without appropriate workup, 1 death, 1 terminal cancer, 1 delayed cancer diagnosis, 1 near-fatal cardiac event. The commission deliberated for 6 hours before issuing their decision. Dr. Richard Kelsey's medical license was revoked. The commission's written decision was 43 pages long and systematically dismantled every aspect of his defense. They found that he had repeatedly failed to meet minimum standards of medical care, that he had demonstrated a pattern of dismissing patient symptoms without adequate evaluation, that his practice patterns reflected dangerous shortcuts and insufficient patient interaction time, and that he had shown no insight into his failures or willingness to modify his practice. The revocation was permanent. He would never practice medicine again. The criminal investigation came next. The family of Lisa Thorne, the woman who died from the stroke, pushed for criminal charges. The local prosecutor initially declined, saying that medical negligence was typically handled through civil malpractice suits, not criminal prosecution. But the pattern of behavior, combined with the non-disclosure agreement that had hidden Lisa's death from public scrutiny and allowed Dr. Kelsey to continue harming patients, created a case for criminally negligent homicide. The prosecutor reconsidered and filed charges. The trial was 6 months later. I attended every day, sitting in the gallery with Rebecca Thorne and other victims of Dr. Kelsey's negligence. The prosecution presented our cases as evidence of a pattern, showing that Dr. Kelsey's dismissal of Lisa's symptoms wasn't an isolated mistake, but part of systematic negligence. Medical experts testified about the standard of care, about how any competent physician would have recognized Lisa's symptoms as warning signs requiring immediate imaging. The defense argued that Dr. Kelsey had made a judgment call that turned out to be wrong, but that didn't rise to criminal negligence. The jury deliberated for 3 days. They came back with a guilty verdict on criminally negligent homicide. Dr. Kelsey was sentenced to 2 years in prison. Not enough, in my opinion, but more than most negligent doctors ever face. He was also ordered to pay restitution to Lisa's family. His medical malpractice insurance covered the wrongful death settlement, but the restitution came from his personal assets. He lost everything: his license, his practice, his reputation, his freedom, his wealth. My own malpractice case settled for $1.8 million 6 months after the criminal trial. The settlement covered my medical expenses, lost wages, pain and suffering, and punitive damages for Dr. Kelsey's egregious negligence. His malpractice insurance company paid the full amount without going to trial. They knew they'd lose. The evidence was overwhelming. My attorney Brennan told me it was one of the clearest cases of medical negligence he'd seen in 30 years of practice, but money didn't fix what had been broken. I had 2 stents in my heart. I took 5 different medications every day. I couldn't exert myself the way I used to. Running was gone from my life. I got winded climbing stairs. I lived with the knowledge that I'd been right all along, that my body had been screaming for help, and that the person I'd trusted to listen had dismissed me as crazy. I had nightmares about collapsing in Dr. Kelsey's office, about him standing over me with that expression of panic, realizing too late that he'd been catastrophically wrong. The physical recovery was long, but manageable. Cardiac rehabilitation helped me rebuild strength slowly. The medications kept my blood pressure controlled and prevented blood clots around the stents. My cardiologist, Dr. Foster, monitored me closely with regular stress tests and imaging. Physically, I was stable. Mentally and emotionally, I was a wreck. I developed actual anxiety. Ironic, since that's what Dr. Kelsey had misdiagnosed me with. But my anxiety wasn't about imaginary health problems. It was about real ones being dismissed. I became hypervigilant about symptoms, terrified that if something else went wrong, doctors wouldn't believe me. I had panic attacks in medical offices. I recorded every appointment on my phone because I couldn't trust that doctors would listen or document accurately. I started therapy with a psychologist named Dr. Kenji Yamamoto, who specialized in medical trauma. He helped me understand that what I'd experienced was a form of gaslighting, where an authority figure had systematically undermined my perception of reality. Dr. Kelsey had made me question whether I was crazy, whether my body was lying to me, whether my fear was irrational. That kind of psychological manipulation leaves scars even after the physical danger is resolved. Dr. Yamamoto helped me work through the anger and betrayal, helped me learn to trust my own experience again, helped me understand that advocating for myself wasn't being a difficult patient, it was survival. I joined a support group for medical negligence survivors. Sitting in a circle of people who'd been dismissed, misdiagnosed, or harmed by negligent care was both validating and heartbreaking. Everyone had their own version of my story. A man whose appendicitis was dismissed as gastritis until it ruptured, nearly killing him. A woman whose breast cancer was missed on 3 separate mammograms because radiologists didn't look carefully enough. A teenager whose meningitis was diagnosed as flu until he went into septic shock. We shared our experiences, our anger, our fear, our strategies for navigating a medical system that had failed us. The group became my lifeline, proof that I wasn't alone, that dismissal and negligence were systemic problems, not isolated incidents. Rebecca Thorne and I stayed in touch. We both felt that our cases, while personally devastating, had exposed a larger problem that needed addressing. Dr. Kelsey wasn't an anomaly. He was a product of a system that incentivized speed over accuracy, that allowed physicians to see 40 patients a day in 7-minute appointments, that relied on snap judgments rather than thorough evaluation. Together with several other victims, we formed a patient advocacy organization called HEARD. Our mission was to push for reforms in how medical concerns were evaluated, to fight against dismissal of patient-reported symptoms, to advocate for minimum consultation times and mandatory second opinions for certain presentations. We testified before the state legislature in support of a bill requiring physicians to document specific clinical reasoning when declining to order diagnostic tests for potentially serious symptoms. We advocated for better training in medical schools about implicit bias and how it affects diagnostic accuracy. We pushed for reforms in how the Medical Commission investigates complaints, eliminating the ability of physicians to settle negligence cases with non-disclosure agreements that hide patterns of harm. Some of our advocacy succeeded. Washington passed Lisa's Law, named after Lisa Thorne, requiring physicians to document clinical decision-making when symptoms consistent with serious disease are attributed to benign causes. It wasn't enough, but it was something. I went back to Dr. Kelsey's office building once, about a year after his license was revoked. The medical plaza was the same, modern and expensive, full of specialists in fancy offices. Dr. Kelsey's suite on the third floor was empty, lease sign in the window. The waiting room where I'd sat filling out intake forms, trusting that I was in good hands, was vacant. The examination room where I'd collapsed was probably still there, same furniture, same fluorescent lights. Another doctor would move in eventually, hang their own diplomas on the walls, see their own patients. I hoped they would listen. I hoped they would order the tests. I hoped they wouldn't let their biases and assumptions override what patients were telling them. 3 years later, I'm alive. My daughter Lily is 11 now and doesn't really remember the time when Daddy was sick, when I was too exhausted to play with her. She knows I have to take medicine and can't run around like I used to, but to her that's just normal. My cardiologist says my stents are functioning well, my ejection fraction is good, my prognosis is positive. I'll need to be monitored for the rest of my life. We'll always be at higher risk for cardiac events, but I'm stable. I'm one of the lucky ones. I collapsed in Dr. Kelsey's office instead of at home alone. Paramedics arrived quickly. The ER doctor at Harborview took me seriously. The catheterization caught the blockages before they killed me. So many things could have gone differently. I could easily be dead. Lisa Thorne is dead. Margaret Sutherland died 8 months after testifying at the Medical Commission hearing, her ovarian cancer taking her exactly when doctors predicted. The other cancer patient, the one with delayed colon cancer diagnosis, survived, but lives with a colostomy bag and permanent damage. We're the visible cases, the ones who complained and fought and demanded accountability. How many other patients has Dr. Kelsey harmed over his 26 years of practice? How many people died or suffered because he dismissed their symptoms? How many patients never filed complaints, never connected their bad outcomes to his negligence, never knew that their suffering was preventable? The system that allowed Dr. Kelsey to practice negligently for decades is still largely intact. Physicians still see too many patients in too little time. Diagnostic errors still happen at alarming rates. Patients, particularly women, people of color, and those with mental health histories, are still routinely dismissed when reporting symptoms. The reforms we've fought for are minimal, easily ignored, barely enforced. Medical culture still protects doctors over patients, prioritizes efficiency over accuracy, treats patient concerns as annoyances rather than valuable diagnostic information. But I'm alive to fight for changes. I'm alive to tell my story. I'm alive to warn others to trust their bodies, to push back when dismissed, to demand tests and second opinions, to advocate fiercely for themselves because no one else will. I'm alive to sit with newly diagnosed cardiac patients and tell them they're not alone, that it's okay to be scared, that their lives can continue with proper treatment. I'm alive to testify whenever needed about Dr. Kelsey's negligence, to ensure his victims aren't forgotten, to prevent the system from burying these cases in settlements and silence. Every day I wake up and take my medications. I think about the examination room floor, about the copper taste in my mouth, about Dr. Kelsey's face going pale. I think about how close I came to dying because someone with power and authority decided my experience wasn't real. I think about Lisa Thorne teaching her last class before collapsing. I think about Margaret Sutherland planning her funeral. I think about all the patients currently sitting in examination rooms being told their symptoms are anxiety or stress or hypochondria when something serious is actually wrong. And I stay angry. Anger is useful. Anger drives advocacy. Anger prevents complacency. I channel it into HEARD, into legislative testimony, into supporting other victims, into ensuring that Dr. Kelsey's legacy isn't just the lives he destroyed, but the system changes his negligence finally forced. It's not enough. It will never be enough, but it's something. I collapsed in Dr. Kelsey's examination room and lived to expose him. That's my victory. Hollow as it sometimes feels. I'm here. I'm fighting. And I'll keep fighting until the medical system actually listens to patients, until dismissal has consequences, until no one else has to beg for the care that saves their life. If you enjoyed this, you'll definitely want to see the next ones too. So subscribe now and let me know your take in the comments.